Hi, Dr. John with ProChiropractic, and today we're talking about 3 foam roller stretches that you absolutely need to know if you've got sore lower legs. So if you're a hiker, if you're a trail runner, or maybe you're a gal that's walked around all day in high heels and are just sore in those calves and lower legs, foam roller stretching is a great way to get loosened up to feel better. So McKenzie's going to demonstrate a couple of these, and we're going to start with the shins. So the front part of the leg, muscles are in there, are the tibialis anterior, and a common problem that we'll notice with this is something called shin splints. But you can really mobilize the lower part of the leg nicely, planting the hands, getting the shins right on the foam roller, and rolling slowly back and forth. Foam roller stretching is important to remember that 30 to 90 seconds per body part is all you need. If you spend 10 minutes on each area, you are going to be too sore and actually cause a little bit of injury. So this is a great way to get those front part of the shins loosened up. Now we're going to go to another stretch, and this is for the calves. So the muscles on the back part of our leg, there's 2 muscles in here. One is called the gastrocnemius and one is called the soleus. One of those muscles crosses the knee and one doesn't. So you want to make sure you go clear from the Achilles tendon up a little bit past the knee when you do this stretch. This one can be really sore. Our calves, especially if we've been hiking or moving up and down hills, walking in those high heels, they can really be tender. And so you want to start easy with a foam roll that's the right kind of firmness, not too firm to start with. Now we can make this one a little more intense by crossing one leg directly over the widest part or the belly of the muscle. This one gets pretty intense in there. So again, not more than 30 seconds starting out, and work to a maximum of about 90 seconds or a minute and a half. Okay? Last one we're going to do focuses on the hip flexor, or what we call the psoas muscle, and where that psoas muscle inserts. So the important thing here is position. So Kenzie is going to rotate her hips here so the front part of her hip is right against that. Using her arms to stabilize her and her other leg to take a little pressure off, she's rolling right through the front part of her hip. Now if you have a tight hip flexor, you're definitely going to notice this on this stretch. If you don't feel a lot of tenderness in here, it's a good area to stretch out anyway to prevent future problems. But if you've been spending a lot of times in the mountains, hiking, biking, trail running, a lot of up and down hills, you should have some tenderness in this area, and this is a great stretch. So again, to summarize, we had 3 different stretches, one for the lower leg on the front, one for the calves on the back, and one for the hip flexor. Great stretches if you're out there in the beauty of Montana or anywhere else. So if you want more information, log on to our website, click the link below. We've got some great reports and some other videos that you can link to at prochiromt.com. Again, Dr. John Wilhelm, Sports Medicine Specialist. Thank you.